Good evening, everyone. As you could read in front of your screen, you could see that I received today on 21st of September one feedback from one candidate who appeared in Mrcs Osce exam in Sri Lanka. And according to the candidate, most of the stations came from the normal, usual recall stations, as you could see. Some of the questions which candidate experienced were little difficult, and they were new questions, especially the dorsum or extensor compartment of the hand or the dorsum of the hand. And what I would say regarding to the dorsum of the hand or the extensor department or extensor compartment of the hand, it's very important. Starting from the dorsal palmar arch, extensor muscles of the hand, palmar what you say, the cutaneous supply of the hand and the anatomical snuff box, extensor retinaculum, and whatnot. These are just a few. The insertion and extension, insertions of the extensor digitorum muscles, right? And these are all like just to name few topic which are very important and are considered or covered in the back of the hand. So if I could quickly give you an overview, I've already told you extensor compartment, right, extensor retinaculum, as I'm saying, and then yes, extensor retinaculum and dorsal palmar arch. What more I can tell you? Cutaneous supply or the overview of the hand. I've already told you. Right. So there are even the anatomical snuff box comes in the dorsum of the hand. Also, if you're considering like extensor retinaculum, then there is entrapment can occur, the entrapment of the radial nerve as well. So that is also one of the important topic that can be covered. What more I can tell you? Yes. Right. Yes. So these are the important dorsal surface of the hand. Right. So these are the important topic in the dorsum of the hand which can be covered and are very important. And again here you can again revise the carpal bones, distribution of the synovial membrane or the along the tendons, right? And the vessels or the cutaneous distribution of the nerves in the dorsum of the hand. So you could see, I'll tell you, if radial nerve supplies the hand, medial, lateral 3.5 part of the hand. I cannot show you the image right like this, but the medial 1.5 is supplied by the ulnar nerve, even the nail bed, and the lateral 3.5 are supplied by the median nerve, even the dorsum. of the hand. So this is very important for you to know. If you have to cover if I quickly tell you about the nerve distribution, then let me tell you the median nerve I've already told you, and the sagittal branch of the radial nerve. Right, and this is radial. Okay, one more I tell you about the vessels. Okay, there is the radial artery. As you know, it lies in the floor of the anatomical snuff box. From here, it divides into the basal metacarpal arch. This basal metacarpal arch again gives several branches, and one is the continuation. So the branches that it gives are called dorsal metacarpal arteries. These dorsal metacarpal arteries, they go up to the tip of the fingers, becoming the digital arteries, and like this, they supply the complete hand. So these are the supplies. And if I tell you about I've already covered the extensor retinaculum and everything. So yeah, that's just my overview for today's feedback regarding the exam pattern and scenarios, how it's coming in exam these days. I hope it would help you and wish you all the best.